All right, good afternoon, everyone. We're going to get started. I do have a few announcements, if you can just bear with me. I'm sure you all have heard on the news about the SNAP benefits for those folks that receive SNAP benefits. This week, the USDA sent out states guidance that decided that partial November SNAP is to be lowered to the max SNAP households can get to 65%. This does not mean that all SNAP households will get 65% of their normal benefit. About 50% of the households will get the 65% of their normal monthly benefit amount. The other half will get less, some getting zero SNAP benefits. So they estimate that it will take about approximately 1 week for DTA, which is the agency that runs the SNAP program, and the EBT vendor, which is the EBT card that you get, that vendor, to make those system changes to send November SNAP benefits to client cards. So DTA is working as quickly as possible to ensure clients receive their benefits promptly. If you have any questions, any concerns about your SNAP benefits, please come see me or Gail. We'll try to help you. Just so you know, on Tuesday, the Senior Center is closed in honor of Veterans Day. Thank you all those who have served. We appreciate you as veterans. Thank you for your service. Yes. However, the Uxbridge High School students will be here on Tuesday serving coffee and donuts for veterans from 9 to 11 o'clock. So all veterans and their families are welcome to come. Also on Veterans Day, our veterans will be honored at the Town Common, and I heard it's at 10:30, be there for 10:30. And then after, the VFW is having a small gathering. Don't forget, next week, Thursday, November 13th, is Big Bingo Game. Those of you that have not signed up, it is $10. You can sign up at the desk with Cecile, and that will be this Thursday. It starts at 1:30. Also, Thanksgiving lunch distribution will be held on Monday, November 24th. That's a free lunch for all Uxbridge residents. Seniors and disabled that are interested in receiving that. It can either be delivered to your home or you can come and pick it up. And that's a luncheon, so that's anywhere between 12 and 1:30. So if you haven't signed up and you're interested, please come see me or Gail. The OLV students are here. Thank you guys for helping out again. Appreciate your help. And today is Lunch and Learn. Thank you, Chief, for Lunch and Learn today. And he'll be introducing our speaker shortly. Where's Sally? Sally, do you have anything?
Sally, do you have
No. Pat? You go. Bob, what would you?
I believe if you call your senator and your congressman and tell them to get this government shutdown open up, it would help.
Yes. Yep. Absolutely. Get things going, get back in business, right?
Yes.
All right. Let's do a moment of silence before lunch. Thank you. Enjoy your lunch.
Ladies and gentlemen, welcome to another Lunch and Learn. My name is Mark Montmany. I'm the Chief of Police here, for those of you who don't know me. I'm here with my assistant, Claudine. And we have a great guest speaker for you today. But before we get into that, we got first night coming up very soon. I believe it's the 6th. The 6th of December, his first holiday night. I know all of you want to meet Santa. Santa will be there. So make sure you come out. And also, we're having a toy drive. The police department and fire department are sponsoring a toy drive Saturday after Thanksgiving. So if you can come down to Hannaford's, we're going to be at Hannaford's collecting toys. If you've got anything you want to give us, see us there then, okay? For our guest speaker today, I'm going to introduce Eric Kramer from St. Vincent Medical Group, who is going to introduce our guest speaker.
Thank you, everyone. Before I introduce our medical provider today to give our talk, I just want to give a brief announcement of what we have available here for information. We have a variety of different pieces of collateral, including the bio card for our presenter today, as well as flyers that discuss some of the services that are being provided by our medical providers with St. Vincent Medical Group here in Worcester County. And if anybody would like to sign up for our monthly newsletter that we send out, you'll be put in for a drawing for our gift basket that you see on the table that has a bunch of goodies on it, which if anybody signs up today, we can do the drawing today, randomly. And so please feel free to come up to the table and grab any of the pieces of information that you would like. Without further ado, I'd like to introduce our doctor today. Dr. Krishna Charakuri is a cardiologist with St. Vincent Medical Group, and he works out of our Worcester office at St. Vincent Hospital. So I'll turn it over to Dr. Charakuri.
Thank you, Eric. Thank you very much for having me today. Such a lovely day and start of the holiday season. And thanks for everyone to show up here and eager to learn. So today I'm going to try to keep it very simple, but we're going to talk about the very important topic of heart health. Okay, so as Eric said, I'm a cardiologist, so I'm specialized in taking care of heart, but in specific, I specialize in taking care of heart blockages and putting stents in if there is heart blockages, and also I specialize in taking care of heart valves and putting artificial valves without doing an open heart surgery. So I work primarily from St. Vincent Hospital, and my disclosures, I don't have any disclosures for today other than trying to make your heart healthy. All right, the few topics that we're going to talk about are the most common heart conditions that we see in our office, and I want to go over each and individual heart condition and what are the things that that we can expect with these heart conditions and how we can prevent them or identify them so that we can get help sooner. So the first common heart condition that we see is heart blockages, or what we call as medically coronary artery disease. So what it actually means is, for this talk, I want you guys all to imagine your heart as your home, and we're going to talk about different parts of the heart, comparing that to the house. It's easy to understand. So when it comes to coronary artery disease, so I always tell my patients that it is something similar to having clogged plumbing in your house. So basically, heart has blood vessels on top of itself that supplies all the oxygen, nutrients, so that the heart keeps pumping 24/7. So these blood vessels carry the blood, and when there is a blockage that happens in these blood vessels, that's what we call as coronary artery disease. So when we are born, as you can see, the healthy artery is like really wide open pipe. There is no problem. The blood is going smoothly. As people get older, there's risk factors that we are going to talk about next. The blood vessels get clogged up with these blockages, cholesterol. As these blockages get worse and worse, that's when we start seeing problems, because heart is constantly working. It needs oxygen, it needs nutrients. So when there is blockages blocking this blood supply, that's when the heart would start noticing problems. So when the blockages typically get to 80%, usually 70 to 80%, that's when heart would start giving signs, hey, there's some problem, we need to look at it. Until then, heart is capable to be able to just work with the blood supply that it's getting. But when blockages get severe to 80%, it starts showing some symptoms. So what are the symptoms? So usually patients start having chest pain. So chest pain in the below the mid part of your chest wall or sternum, what we call, or sometimes the chest pain is on the left side of the chest, which is where the heart is. And a lot of times the pain coming from the heart usually goes to your shoulder to your back, sometimes to your neck and jaw as well. Especially in females, the pain is very atypical, meaning they can have some pain in the belly, the pain in the jaw, and pain in the back and shoulders can also be a typical way that the heart disease presents. And when people have this type of chest pain, especially starting suddenly, all of a sudden, within 10 minutes or 15 minutes, that is something that is very important to pay attention to and get medical attention right away. So that if this is something that is a sign of heart attack, we need to get them to the hospital and treat this very fast. So when we see these heart blockages, there are a few treatments that we can do. Primarily, the most easiest and straightforward thing is to go in, do a heart catheterization, and open this blockage by using stents. So the next problem that we're going to talk about is congestive heart failure. So this is also very common that we see. Usually, congestive heart failure is something that means that your heart is basically a pump. It's pumping all the time, taking the blood from the lungs and pumping it out into the body. So the heart pump can get weaker, so that's what we call as heart failure. But there are two types of heart failure. One is when the pump is weak and it's not able to pump blood forward, and the other type of heart failure is when the heart muscle is stiff, so it's not able to take the blood properly because there's a lot of hypertension and cause the valvular problems that can cause heart to get thicker. So either of these conditions can cause heart failures. The major problem with that is heart is unable to pump blood efficiently. So that's what basically presents itself as trouble breathing. So essentially what happens is when you're trying to get up, walk around, your heart is not able to meet your demands and not able to pump the blood forward to your whole body. So that, that's when patients start having difficulty breathing, and also swelling in the feet is one of the common things that we see with this type of heart failure. And also fluid accumulation in your lungs can also cause breathing trouble, indeed from the heart failure. So these are the few common conditions or common symptoms that we see, and recognizing them would help us to find the heart failure early on. And there are a lot of different kinds of reasons that can cause heart failure. We talked about the coronary artery disease or the heart blockages. So heart blockages, when it's not treated in time, that can cause heart weakness. So that is one of the most common causes of heart failure, having heart blockages causing the weakness. The high blood pressure or alcohol, any of these other conditions other than heart blockages can also cause heart failure. The other heart condition that we see commonly is heart valve problems. So when I say heart valve, I want you to imagine you're in the house analogy, the doors in between your rooms. So heart has 4 chambers, just like you have rooms in the house, and the doors in between the rooms are similar to the heart valves. So these heart valves that are in between these heart chambers open every time the heart beats and close. So that's what allows the blood to move forward and not backwards. So these heart valves over a period of time can either get leaky or they can get narrowed. So when we see these heart valves having difficulty in opening or closing, that's what causes heart valve problems. One of the most common conditions that we see, especially in elderly, is what we call as aortic valve stenosis. So it's a valve that stays between your main pumping chamber of the heart and the aorta, which is basically the tube that takes the blood from the heart and distributes to the whole body. So this valve, as you can see here, there are 3 doors or 3 leaflets which basically open. When you see that this is a healthy valve, when it is opening, it's nice and opening wide and closing like this. But as time gets on and the calcium gets deposited on this valve basically gets very calcified, thickened, and narrowed. So instead of opening like this, the valve's doing this. So pretty much, unable to open, so that puts more pressure on the heart to pump the blood to overcome that narrowing and tightness. So this is something that we commonly see, and 15, 20 years before, for this type of heart condition, the only treatment is doing an open heart surgery so that the heart surgeon takes the old valve and they puts the new valve in. But nowadays, we actually can go through the groin and we take up a new valve that's basically clamped on a balloon, and we get this new valve to the old tight valve. Once we're in place in this old narrow valve, we open the new valve so that this new valve pushes the old valve to the side and takes its place. So essentially, you can replace the whole heart valve without really opening the chest. And usually, the patients get to go home within 1 day, so very fast recovery without requiring an open heart surgery. So this is something that we do at St. Vincent's, and help these patients recover faster and get back to their routine within a few days. So this is one type of heart condition that we see. The another most common condition that we see is heart rhythm problems. So in the analogy that we talked about, I want you to think about electrical wires that run through your house. So heart has electrical wires running through its muscle that makes the heart beat 70 or 80 times a minute. So when these electrical wires get slower, or if you have trouble having these electrical heartbeats, that's what we call as electrical arrhythmias. So it can be slow heartbeat or fast heartbeat. When your heart beating is slower and your heart's not able to beat as best as it should, that's when people need pacemakers. So pacemaker is nothing but a device that tells the heart to beat so many times a minute when its electrical wires are got disturbed. The other heart condition that we see is an electrical condition. It's called atrial fibrillation. You must be heard about this condition. This is something that is very common that we see almost in 1 in 4 people who are 75 and older. So what it is basically typically heart is designed to beat rhythmically so that the top chambers get the blood, it contracts and get the blood to the bottom chamber. What happens with atrial fibrillation is the top chambers are beating so fast and very irregular, so that's why we call this an irregular heart rhythm. And your heart's beating faster but also irregular, so that makes the blood difficult to get from one chamber to the other chamber, which increases the risk of blood clots in the heart. So these blood clots, unfortunately, can cause strokes, which is why when we have patients who have atrial fibrillation, we keep them on blood thinners to help prevent those strokes. And sometimes if patients are not able to take blood thinners because of bleeding, then we have a procedure that we can do, which is called Watchman. Essentially, this avoids the requirement of blood thinners and protects them from stroke without requiring a blood thinner. So these are some common heart conditions that we see. I just want to talk about things that we should look out for, or if there's any problem, when to talk to your physician or go see a cardiologist. So as we talked about these heart conditions, the most common thing that I want everybody to pay attention to is how they're feeling, especially when they're getting up, walking around, doing your regular chores in the house, be it taking care of your pets or walking around, cooking, cleaning, laundry, any activities that you do routinely. If you start noticing that you're getting out of breath more than usual, that can be a sign of heart problem. And having chest pain or chest discomfort or pressure-like sensation that happens when you're doing these simple activities which have not been any problem before, which if you start noticing those issues, that may be a small indication that we need to look at your heart and make sure everything is okay. And a few other things that also is important to pay attention to is having swelling in your feet, or if you notice that your legs and ankles are getting excessively swollen, that is also one important sign to keep attention to. Or if you start noticing your heartbeat, if you have heart palpitations, meaning your heart is racing for no reason, or if it's racing excessively than what it has been with simple activities. Those also are important symptoms to pay attention to. So once you have noticed these problems, talk to your primary care doctor or go see a cardiologist so that we can assess and diagnose properly, quickly, so that we can prevent any further problem or damage to the heart. The few things that I wanted to discuss about how we can prevent, because prevention is better than cure, so there are things that we can do to try and prevent any type of heart problem. So the important thing is, focusing on diet, like what kind of diet we take. This is a slide to kind of simply, show you, try to get more vegetables and fruits, at least 50% with your green leafy vegetables on a plate, and having a good healthy protein and less amount of carbohydrates and unsaturated or unhealthy fats. And controlling that portion is going to help you a lot, and trying to get the right amount of nutrition and right type of nutrition. So that plays an important role. And doing some exercise regularly. I always tell my patients, moving is important no matter how much you move or how long you move. As long as you're trying to get your body to move, do some walking or any type of simple exercise that you can, at least 15 to 30 minutes a day. Start off with 15 minutes, but 30 minutes is your mark. American Heart Association recommends at least 30 minutes of exercise 4 to 5 days a week to keep your heart healthy. So that is very important. And a couple of other important things and the risk factors that can cause heart blockage that we talked about is high blood pressure is one of the biggest culprit. So make sure that your blood pressure stays in a healthy range. What is a healthy range? So your top number of your blood pressure in 120s to 140s, and the bottom number less than 90. So sometimes when you go to primary care's office, your blood pressure might be okay, but when you go there once every 3 months or 6 months, it doesn't reflect how your blood pressure is doing on a day-to-day basis. So I always tell my patients to try to get a blood pressure cuff, or when you come to the pharmacy or drugstore, a lot of them have blood pressure machines. So try to get your blood pressures checked as many times as possible so that we get more information with your blood pressure numbers. So we want to keep the blood pressure in a good range because that would prevent your heart from having any blockages, heart failure. It can prevent the strokes as well. So that's another important thing. And cholesterol. So one other important thing that we need to keep an eye on with repeated blood works every 6 months or every year is to see how good your cholesterol levels are maintaining in your body. So especially the bad cholesterol, the LDL, which is what we pay attention to, should be less than 100, if possible. There are different types of medications that we can use if the cholesterol numbers are very high so that we can reduce the risk of cholesterol causing problems in the future. Yep, and diabetes is one of the other important risk factors that is been shown time and time again that it can cause problems with your heart, not only with your heart but also your kidneys. So it's important to keep your sugars under control and make sure that your diabetes numbers are in control so that it doesn't affect your heart. So I went through quickly at the end, but please ask any questions, anything that we can talk about. I'm open to questions, and we can discuss more individually. Thank you very much. Thank you. Yes.
I have a question on AFib. I just recently had a very severe case of it. It just came on and never had a problem in my life. And it was like a boxing match in my heart. So I want to know, is that always going to be a chance that you can get AFib again? And how long would you keep on the blood thinners if everything's going smoothly, say for a year or two? Do you still have to stay on it? Or?
Yeah. Great. So the question was, AFib is something that came along, whether we need to be on a blood thinner, even though atrial fibrillation is not happening again. So to answer your question, the atrial fibrillation is something that happens randomly, and it happens without any warning signs. And there's a saying in cardiology that we learn. Once you have AFib, it can always come back. You have an AFib, it will come back. It's only a matter of time when. So that's the main reason why that we keep patients on blood thinners, because 80% of the times you may not feel when your heart goes into a regular rhythm. You only feel your AFib when your heart is going faster, not only in AFib, but AFib, fast AFib. So there are times where when you're just resting at home, not feeling anything bad, but if you actually look at or get an EKG, you may be in AFib. So that's the problem with AFib, because a lot of times it doesn't cause any symptoms when the heart is actually beating slow, not fast. So that's why we do recommend keeping the blood thinner, just for that reason, because it can come back anytime without giving you any warning signs. And the first warning could just be that you could develop a blood clot and have a stroke, which is essentially what we absolutely don't want. That's why we keep the blood thinner on board. But there are, obviously situations where we are between rock and a hard place. Some patients may have bleeding problem, or they have trouble with balance, and it's very hard to maintain on a blood thinner. That a strong blood thinner which can cause bleeding if you have a fall and things like that. So that is why, we do have some additional procedures that we offer that helps patients to have that peace of mind to not have a stroke even though they're off a blood thinner. So to answer your question, I think you should be on a blood thinner once you are diagnosed with AFib, and potentially keep some medications that would prevent it from happening. Yeah.
Thank you.
You're welcome. Any other questions on? Yes.
You mentioned about women having different types of symptoms and
Yes.
signs of heart attack.
Yeah.
How would I know if I'm having a heart attack versus just?
Yeah. Great question. So the question is, women having different symptoms from heart attack compared to what we normally expect. So you're exactly right. So in females, the symptoms can be very, very different, and it can change with age as well. So yeah, sometimes you can have much more atypical symptoms when you're younger. You may have more typical symptoms as you get older. But regardless, I always tell my patients, when in doubt, always at least get some medical help. All we need to do is to just get an EKG, which can be done at any urgent care, primary care's office, just to avoid and make sure that you're not having a heart attack. A lot of times, heart attack, presents the traditional way. I would say 80 to 90% you would see patients developing some type of chest pain or some type of impending doom sensation. There's something wrong going on. They have sweating, they have shortness of breath, they have heart fluttering palpitations. All of these as a combined symptom pattern that comes along. But those 10% or 20% of the times that it can come as nausea, heartburn, sweating, without any chest pain. It's always important to just get that medical help, no matter what time it is, because it's so crucial to get this diagnosed as soon as possible, because we have systems in place to help the patients who are having heart attack. We have doctor like myself and a team of 4 nurses on call 24/7 for emergencies, like somebody comes in with a heart attack. Once it gets diagnosed with EKGs, we have 30 minutes for us to be there in the hospital and help these patients recover, and we can put a stent in within 60 minutes. This is some important standards that we hold ourselves to, so that we can help these patients avoid any heart damage. Yes.
Doctor, are the devices that connect to your phone that help you take EKG, are they worthwhile?
Great question. So the question is, the devices that we have nowadays, either it's Apple Watch or some other device that can get the EKG. To answer your question, no, I would not trust those. The technology is not advanced enough that we can rely on these technologies. So EKG, I always recommend getting a traditional 12-lead EKG at an urgent care. So these devices, in fact, all these devices, in fact, advertise that they don't or they can't detect heart attacks. So, yes, great question. Yes, ma'am. So the question is about bundle branch block. I think that's what you're referring to. So when we talked about the electrical wiring in your heart, so basically the electrical wires run all around the heart, and as it goes through, it divides into what we call as left bundle branch block and right bundle, or left bundle and right bundle, which is basically a thick electrical wire that's going into the bottom part of the heart that helps the heart to contract. So when we say bundle branch block, what that means is the electrical wire that is taking the electrical impulse to the heart muscle has gotten slower. So it's not it's not conducting as well as it should. So this can happen sometimes because of a heart blockage, or this can happen because of aging as well. There's no problem just by itself unless there is something else that's causing it. So when we see this type of problem, we always want to know what's causing it, by doing a stress test or something else to find out. Any other questions? Yes.
On occasion, the valve replacement is not effective. Something else has to be done. The pacemaker has to go in. How often does that occur, and what's the time span between the valve being put in and forward operating?
Yeah. So usually the type of valve replacement that we talked about, these valves are made of tissue. What we call as tissue is basically these valves are made of either cow's heart tissue or pig's heart tissue. So these tissue valves just behave just like your normal valves. So they are prone to getting narrowed again, meaning all these forces, all these risk of basically this blood pressure, diabetes also affects these new valves. So we always say the new valves that we put in, if it's a tissue valve, they have a lifespan of about 10 to 15 years. If it's a metal valve or mechanical valve, which is only done by the open heart surgery, so when the surgeon puts a mechanical valve, those last for life, meaning they don't have any problem because they're made of metal, they can't get any bad. But the only caveat to putting metal valves in every patient is that for metal valves we have to keep the patient on blood thinners lifelong. So that's the problem with it. That's why we don't offer metallic valves in some patients who can take blood thinners. So to answer your question, these valves typically last, if it's a tissue valve, about 10 years. And a lot of times, we do look at what would be the best strategy. Let's say if somebody comes in young, about 60 to 70, if they need second valve in their lifespan, we kind of plan ahead of time when we take care of the first procedure. So yeah, great question. Yes, ma'am.
What's the purpose of wearing or having a monitor for, say, 1 day, 24 hours, and then 14 days?
Yeah, great question. So the question is difference between wearing the heart monitor 1 day versus 14 days. So what is a heart monitor? So heart monitor is basically a device that we can basically stick it onto the chest wall with using a tape so that it tracks how your heart is beating 24/7. So let's say if somebody is having fast heart rhythm or fast heartbeat, and they come to me and say, I'm having the heart fluttering, it's happening like maybe once in a week compared to once a day. So we don't know, so there are lots of heart conditions that can cause heart racing or heart fluttering. So it can be atrial fibrillation, it can be slowing of the heartbeat, it can be atrial flutter. So it's important for us to catch those episodes while they are happening to understand what's causing it and how we can treat it. So that's why we use the heart monitors to tell us what's happening when you're having these symptoms. So if somebody is having heart problem or heart palpitations randomly once or twice a week, I would rather be safe to get more data and do a heart monitor for 2 weeks than doing it for 2-3 days, which we might risk not catching these episodes.
And if you were not having or were not aware of having anything going on with your heart, why would they recommend having this done?
Yeah, good question. Good question. So remember we talked about this atrial fibrillation. So atrial fibrillation is something that commonly happens as you get older. Like there is statistically that we have seen patients who are past 75, 1 in 4 people will have this type of problem, the atrial fibrillation. So it's possible that's maybe why they're recommending it, to make sure that you're not having AFib without you actually having any symptoms. It's rare. I don't do it as often unless there is any clinical, symptoms or problems that you're noticing. Yes, ma'am.
What is the
Why are doctors more concerned about a fast heartbeat? Like I was diagnosed with bradycardia.
Bradycardia, yeah.
Yeah, and the doctors don't seem as concerned as if it was faster.
Okay, so the fast heartbeat is called tachycardia and the slow heartbeat is called bradycardia. So we are concerned equally for both depending on how bad they are. Meaning, so if it's a normal heartbeat and your heart doesn't have any bundle branch block like we talked about, there is no concern for your heart slowing down too much. So if your heart, normally if somebody is active and they're not feeling any symptoms, your heart can be beating at 50 beats per minute, which is slower than normal, but it's completely fine. It's something that we don't have to worry about. But if you have abnormal type of slowing, if there is bundle branch block or there is abnormal slowing of your heartbeat, then that's when we need to put in a pacemaker. So it is important. So when we see that type of problematic bradycardia, we definitely are concerned about it and we would recommend putting the pacemaker. The fast heartbeat, on the other hand, is much more common to see. And when we have that, people have more symptoms from the fast heartbeat than the slow heartbeat. Because usually when you have your heart beating 120 times a minute, when you're just resting there, that's not normal. There's less chance of that being normal than your heart beating at 50 beats per minute, which typically can be normal. Does it make sense?
Yeah.
All right. Yes, sir.
I had a case that shocked me back in the sinus rhythm of the hospital.
Okay, yeah. So yeah, that is one effective treatment that we do when somebody comes in with atrial fibrillation. We try to control the heart rate with some medications. If it doesn't listen to our medications, then what we do is we basically put patients to sleep so that they don't kick us after we give the shock. So basically we help them sleep so that they don't feel the shock, and we basically, it's almost like resetting your TV or resetting your computer, that you're shocking the heart right at the moment where it stops this irregular rhythm and just goes back to normal rhythm.
Put a plate on the front,
Correct.
that, and we get shocked.
Yes. Do you remember that?
I didn't feel a thing, but I knew it good.
Good. Any other questions?
I go to the doctor. I don't need an apple.
Great questions. Yes, ma'am.
My sister just had a surgery to remove the plaque in her carotid artery.
Okay.
So that would have, had she not acted when she did, with kind of like a mini stroke or TIA, whatever it was that she had, she probably would have stroked. Is that what you're thinking?
Yes, it is quite possible. So we just talked about blockages in your heart, but remember your body has blood vessels everywhere. That's how your organs, all the body organs will get blood. So the blood vessels that supply your brain, which are in your neck, if they have blockages, it's called carotid artery stenosis. So that if the blockage in your neck vessels get worse to a point where these blockages can stop the blood supply to your brain, that can definitely cause a stroke. So sounds like she had a mini stroke, which at that point of time it's important to make sure we treat and put a stent in so that it doesn't affect and cause a stroke, actual stroke. Yes. Yeah. Well, thank you very much. I have to say I really enjoyed interacting with you, and thanks for having the opportunity to give me here. And I have to say my office staff were very excited when I said I'm coming here to talk to you guys, because they have family here. They actually born and brought up and raised here, and one of my nurses' father was in police department here before. So they're all excited. So thank you very much.
Thank you very much, Dr. Cherukuri. Did I say that right? Okay. Thank you very much. That was a great talk. I hope you appreciated it. And I think the doctor will stick around for a couple minutes if anybody's got a private question they want to ask. Thank you.